Hello, my name is Taylor Wareheim, and in this reflection video, I will be discussing my overall understanding of the health belief model and how to best apply this model to health education and behavior research. In this video, I will give an overall explanation of the health belief model, briefly explain the constructs and main points of the model, describe the strengths and limitations of the model, apply the health belief model to a health behavior, and mention any questions I have regarding the health belief model. The purpose for the creation of the health belief model was to motivate individuals to take positive action in order to decrease or avoid negative health consequences. The model has been around for about 70 years as it was developed in the late 1950s and is currently the most commonly used theory in the health education and promotion field. Social psychologists in the late 1950s were trying to determine why individuals were resistant to getting tested for tuberculosis, as public health workers were making testing easy and extremely accessible. These social psychologists developed the health belief model to try and figure out why individuals with tuberculosis had resistance towards prevention and detection methodologies. The health belief model was based off of three different theories known as the stimulus response theory, the cognitive theory, and the value expectancy theory. The stimulus response theory is based on automatic behaviors and explains how behaviors are based on consequences such as positive and negative reinforcements. The cognitive theory is seen as the main foundation that led to the development of the health belief model. This theory explains how mental processes are critical towards behavior, and the health behavior model constructs are composed from the framework of the cognitive theory. The value expectancy theory describes how individuals are more likely to behave in a certain way if they believe it will lead them to improved performance. The improved performance will lead to a positive outcome, and they will like that positive outcome. Lastly, the health behavior model is based off of 5 main assumptions that explain why people will alter their behavior, and I will go into deeper detail about these 5 assumptions next. The constructs are the building blocks of the health belief model. The constructs that look at the individual perception include perceived susceptibility and perceived severity. Perceived susceptibility is how susceptible an individual believes he or she is to a certain disease. If an individual has a higher perceived susceptibility, then there is a higher chance that the individual will change the health behavior, and vice versa. Perceived severity is how severe does an individual think the consequences of the disease will be. An individual's perceived severity can be influenced by physical and social consequences and also based on the individual's experiences. For example, an individual's belief that breast cancer treatment requires intense surgery, painful chemotherapy, which can be seen as a physical consequence, loss of being able to go out with friends and have a good time, which is a social consequence, and if the individual saw one of their own family members suffer from breast cancer, which is their own experience. All of the consequences I just mentioned within that example may increase the likelihood that an individual engages in a positive health behavior which can prevent breast cancer, such as going to get a mammogram. The construct within the health belief model, known as the cue to action, can be used to trigger an individual to start towards changing a health behavior. Later in this video, I will explain how this construct can be a limitation of this model. The constructs looking at the likelihood of action include perceived barriers and perceived benefits. Perceived barriers refer to an individual's feelings on the obstacles and barriers to be faced from changing and/or adopting a certain health behavior. Behaviors can be physical or psychological. Perceived benefit refers to an individual's beliefs about the positive outcomes associated with a certain health behavior. The last construct I want to talk about is self-efficacy, and this construct was added to the health belief model in 1988. Self-efficacy refers to an individual having belief in their own abilities to be able to change or adopt a health behavior. As I stated before, the health behavior model has been around for almost 70 years, so it has been tested an abundant amount of times and has shown to be effective. One of the strengths of the model is that it is modifiable, meaning that you do not have to use all 6 constructs together when conducting a study. Another strength about the model is that it is tailored to an individual's needs. The last strength of this model is that it aids in predicting and explaining behavior. It helps to explain why individuals behave the way they do and why individuals don't engage in certain behaviors. Now I will mention some of the limitations of this model. limitation is that little is known about the relationships between constructs. Another limitation is that cues to action and self-efficacy have not been studied enough, and therefore there needs to be more research on those two specific constructs. Another limitation is that the model does not account for environmental factors. The model talks about modifiable factors, however, does not have a modifiable factors as an actual construct. I am now going to show and explain a brief application of the health belief model. I am a public health patient educator who wants to use the health belief model to motivate Jeff to take part in engaging in the health behavior of going to get vaccinated for the COVID-19 in order to decrease his health consequences of contracting COVID. In terms of perceived susceptibility, Jeff must believe he is susceptible to contracting COVID before deciding to get the COVID vaccine. He is in college and attends class every day, is involved in multiple extracurricular activities, and hangs out a lot at different locations on campus where there are thousands of different people. Due to the environment he is in, he admits he has a higher perceived susceptibility, which means there is a higher chance he will adopt to a new health behavior by getting the COVID vaccine. In terms of perceived severity, such as getting a fever, having chills, losing his taste, and having a sore throat, Jeff also knows that by contracting COVID, he will be faced with social consequences, such as being in isolation and not being able to hang out with his friends and have fun over the weekend. Jeff even has a high school friend who died from COVID a few months ago, so there is some experience he has had with COVID. After assessing the consequences of contracting COVID, it may increase the likelihood that Jeff engages in the positive health behavior of getting the COVID vaccine. In terms of perceived barriers, one of the main obstacles stopping Jeff from getting the COVID vaccine is the short and long-term negative side effects that the COVID vaccine is known for having. In terms of perceived benefits, Jeff believes that getting the COVID vaccine will decrease his chance of contracting COVID in the future. An example of a cue to action for this example I am talking about would be a social media ad posted by the CDC suggesting individuals to go get the COVID-19 vaccine, check them and others from getting COVID. Therefore, if Jeff was scrolling on Instagram and saw this type of ad, that would be considered a cue to action. In terms of self-efficacy, Jeff believes he is capable of going to the nearest location where the COVID vaccines are being offered, and he is mentally capable and prepared of motivating himself to go get vaccinated. When discussing the health belief model and specifically focusing on the construct of perceived barriers, the concept of cost-benefit analysis is brought up. There are going to be certain barriers that cause an individual to feel like the perceived benefit is unattainable or too much work to be able to achieve the desired health behavior. When instances like this happen, when an individual is thinking to themselves, what is it worth? How can health educators problem solve and help the individual get past the perceived barriers and allow the individual to view the problem and solution differently? Thanks for listening.